Hello, so my name is Damaris Morales, and I am going to be doing my presentation on sexual function. Sexual function difficulties. Sexual dysfunctions is described as the disturbance in sexual desire and in the psychological changes that characterize the sexual response cycle. This causes distress and interpersonal difficulty. And ultimately, sexual dysfunctions do lead to sexual dissatisfactions, which is a common outcome of a difficulty in sexual function. Some sexual desire disorders are hypoactive sexual desire, which is persistent or recurrent lack of sexual fantasies and desire for sexual activity. This causes distress and is sometimes called inhibited sexual desire or low sexual desire. Sexual aversion disorder is the persistent or recurrent aversion to and the avoidance of genital contact with a partner. Just the possibility of sexual contact may cause anxiety, disgust, or fear in a person with this disorder. Some sexual arousal disorders are the female sexual arousal disorder, which is the inability to attain or maintain the level of vaginal lubrication and swelling associated with sexual excitement. And this may be associated with sexual desire disorder or female orgasmic disorder. And it can occur in women. It can occur when a woman desires sex but has difficulty with arousal. And the male erectile disorder is the inability to attain or maintain an erection until the completion of sexual activity. Orgasmic disorders. A female orgasmic disorder is the absence of or the delay in orgasm for women. This is the second most common sexual function difficulty in women. And for men, it is the male orgasmic disorder, which is the absence of or delay in orgasm for men. This does lead to inhibited ejaculation, which is when a man is unable to ejaculate no matter how long stimulation is maintained, or delayed ejaculation, which is not being able to ejaculate easily, and it can take up to 40 minutes or more. And the next one would be premature ejaculation, which is ejaculation with minimal sexual stimulation, and it's also called early ejaculation or involuntary ejaculation. Sexual pain disorders do include vaginismus, which is the involuntary spasm of the muscles of the outer third of the vagina, which interferes with sexual intercourse, and this does prevent the insertion of a penis, a finger, a tampon, pretty much anything into the vagina. And then dyspareunia is genital pain, which can be mild to severe, associated with sexual intercourse, and this does occur in both men and women. Some physical causes of sexual dysfunctions are, for men, would be diabetes, because diabetes does damage blood vessels and nerves in the penis, alcoholism, or heavy smoking. Studies do show that 50% of heavy smokers are more likely to experience erectile problems. And for women, physical causes do include diabetes or heart disease, poor health, or alcoholism as well. Some psychological causes do include fatigue and stress. Individuals may be physically exhausted from their daily life, ineffective sexual behavior, which leads to sexual function difficulties and dissatisfaction, and can also lead to spectatoring, which is when a person becomes a spectator of his or her own sexual behavior. Sexual anxieties and the excessive need to please a partner. Those would be immediate causes. Another cause could be a conflict within self, like if a person has internalized homophobia, which is self-hatred because of one's own homosexuality, or relationship causes. Sexual function enhancement, developing self-awareness, which is knowing what good sex is to you, discovering your conditions for good sex, or what you like during sex, intensifying erotic pleasure, which would be developing the desire for sex, increasing sexual arousal by having your conditions met, and focusing on your sensations. And you can also find alternatives to intercourse by exploring different ways of being erotic. You can also change a sexual relationship, which can, by putting effort into non-sexual aspects of the relationship, pushing yourself to try new sexual behaviors, or you can address any issues that you have had in the past. You can deal with your own personal issues, and you can also embrace a deeper connection with your partner. And that is the end of my presentation. Thank you.